Andriukaitis is EU Commissioner for Health and Food Safety and a vaccination advocate. He joins us now live from Brussels. Thanks so much for speaking to us. You know, it's amazing that we're actually dealing with entire developed countries declared measles-free and now seeing a resurgence of this disease. Is it all because of this recently created mistrust in vaccinations?
Yes, you are right. Not only mistrust in vaccination, but much complex picture. You know, first of all, let me draw attention on social determinants. Poorest part of societies, less educated people, they have no access to information. They have no access to be vaccinated. A lot of the people in poor regions have no access because of lack of nurses and doctors. We have complexity of issues, but mainly distrust in science and of course anti-vaxxer movement, and this plays very dangerous game today.
In a way, though, we know people got, especially in the developed world, people got complacent, and now we've seen this resurgence. So what do people need to see to be convinced again that vaccinations work and they're not to be feared?
Answering directly, we will organize on 12th of September global summit on vaccination together with World Health Organization, European Union and World Health Organization. We decided to organize big event inviting prominent scientists, medical doctors, patients organizations, and of course those who can be good advocates discussing issues about vaccine hesitancy, about distrust in vaccines, about possibilities to once again to raise high on the agenda awareness campaign and develop the common global strategy. We need to do more because situation is really very dangerous. And now it's time to ask all medical doctors to be active, promoting vaccination as safe instrument which can prevent diseases. Vaccines works. It's simple message to all societies. We have safe, scientifically approved vaccines, and we have strategies in our hands, and we need to do more encouraging governments to understand it, national parliaments to understand it. Of course, also media attention is very important for all of us. We will organize on 12th of September big summit and developing new steps of strategy.
But if the response is not what you want and governments are loath to change their strategy and enforce mandatory vaccinations, what happens? What happens if vaccinations aren't enforced soon?
You know, it doesn't matter mandatory vaccination or voluntary vaccination. The main goal is coverage of vaccinated people. If you have less than 95% coverage of vaccinated children and adults, that's a disaster. And of course, countries should assess the situation. If they have no chance to use voluntary instruments, they need to introduce mandatory vaccination. No doubt, it's not contradiction between each other. One method can support another. They have professions which should be vaccinated. Mandatory, absolutely. And WHO proposed very clearly, strategies. How can we develop the concrete strategies? Because we need to address issues on the ground. And of course, we need to keep in mind cultural traditions, countries' strategies, and so on and so on. But mandatory vaccination will be also a very powerful tool in our hand.
Okay. Vytenis Andriukaitis, thank you so much for joining us there. We greatly appreciate it.